Did you know that leg pain can be a warning sign of heart problems? Learn more about this intriguing connection and how to identify early signs in this video. Leg pain, can it have a cardiovascular origin? Leg pain is not always just a muscular or orthopedic issue. It can be a symptom of underlying cardiovascular problems that deserve attention. Among these problems, peripheral artery disease is one of the leading causes. This condition is characterized by reduced blood flow to the legs due to narrowing or blockage of the arteries. Another common issue is chronic venous disease, which involves damage to the veins of the legs, resulting in symptoms such as swelling, heaviness, and pain. Additionally, deep or superficial venous thrombosis can also cause leg pain, so it's important to identify and treat early. Finally, heart failure can lead to symptoms such as leg edema and pain due to fluid buildup. Therefore, it's crucial to recognize that leg pain can be an indicator of cardiovascular problems and seek medical evaluation for proper diagnosis and timely treatment. Number 1. Peripheral artery disease. Peripheral artery disease (PAD) is a condition in which there is narrowing or blockage of the arteries supplying the lower limbs. This results in decreased blood flow to the legs, causing symptoms such as pain when walking, known as intermittent claudication. PAD is often caused by atherosclerosis, a process of plaque buildup in the artery walls. Risk factors include smoking, diabetes, high blood pressure, and high cholesterol. Diagnosis is made through tests such as Doppler ultrasound and angiography. Treatment may involve lifestyle changes such as quitting smoking and exercising, along with medications and, in severe cases, surgical procedures to unblock or repair affected arteries. Effective management of PAD is essential to prevent serious complications such as leg ulcers and gangrene, which can lead to amputation. Therefore, it's important to seek medical help when experiencing any symptoms related to leg circulation. Number 2. Chronic venous disease. Chronic venous disease (CVD) is a condition characterized by dysfunction of the veins in the legs, resulting in symptoms such as swelling, heaviness, pain, and varicose veins. It is commonly caused by malfunctioning venous valves, which prevent blood reflux back to the heart. Risk factors include obesity, pregnancy, family history, and occupations requiring prolonged standing. Diagnosis is based on symptoms and tests such as vascular ultrasound. Treatment aims to relieve symptoms and prevent complications, including self-care measures such as elevating the legs, wearing compression stockings, and exercising. In more severe cases, medical procedures such as sclerotherapy or surgery may be necessary to correct damaged veins. Prevention of CVD involves controlling risk factors and adopting healthy lifestyle habits. It's important to seek medical guidance when noticing signs of CVD to prevent serious complications such as venous ulcers and thrombophlebitis. Number 3. Deep or superficial venous thrombosis. Venous thrombosis is a condition in which a blood clot forms in a vein, which can be deep or superficial. Deep vein thrombosis (DVT) occurs when a clot forms in the deep veins of the legs, usually causing swelling, pain, and redness. If left untreated, it can result in serious complications such as pulmonary embolism. Superficial venous thrombosis affects veins closer to the skin surface, typically less severe, but can still cause discomfort and localized inflammation. Risk factors include prolonged immobility, recent surgery, pregnancy, and hormonal therapy. Diagnosis is made through tests such as Doppler ultrasound. Treatment may involve the use of anticoagulants to prevent the formation of new clots and reduce the risk of complications. Prevention measures include maintaining mobility, adequate hydration, and avoiding prolonged periods of immobility. It's essential to seek immediate medical assistance when suspecting venous thrombosis, as early diagnosis and treatment are essential to prevent serious complications. Before we proceed with the video, I have an important announcement because I've prepared exclusive content for you who want to know how to improve your heart health. To access, simply click on the link in the pinned comment. Without further ado, let's move on to the next point. Number 4. Heart failure. Heart failure is a condition in which the heart fails to pump enough blood to meet the body's needs. This can result in a range of symptoms, including leg swelling due to fluid retention. Leg pain can be an additional symptom, often resulting from fluid accumulation in the tissues. Additionally, heart failure can lead to reduced blood flow to the legs, causing pain and discomfort. Risk factors for heart failure include high blood pressure, coronary artery disease, diabetes, and obesity. Diagnosis is based on tests such as echocardiogram and blood tests. Treatment aims to control symptoms, improve heart function, and prevent complications. This may involve medications, lifestyle changes, and, in severe cases, surgical interventions such as implantation of cardiac devices or heart transplantation. Prevention of heart failure includes controlling risk factors and adopting a healthy lifestyle, including a balanced diet and regular exercise. It's essential to be aware of symptoms associated with heart failure and seek appropriate medical attention for management and treatment. Now, you might be wondering, I have symptoms, what should I do? When symptoms such as leg pain arise, signaling possible cardiovascular problems, immediate action becomes imperative to ensure long-term health and well-being. The first step when faced with these signs is to seek guidance from a qualified physician who can conduct a thorough and specialized assessment. This professional will be able to perform a detailed analysis of the symptoms presented, as well as perform specific clinical examinations, such as checking blood pressure, cardiac and pulmonary auscultation, and evaluation of peripheral circulation, to obtain a comprehensive understanding of the patient's situation. Complementary tests, such as vascular ultrasound or echocardiography, are crucial for accurate diagnosis of possible cardiovascular problems, such as peripheral arterial diseases, deep vein thrombosis, or heart failure. Based on these results, the physician can create a personalized treatment plan, which may include lifestyle changes, medications, and specific therapies. Ignoring symptoms is not an option, as early diagnosis and appropriate intervention are essential to prevent serious complications and improve quality of life. Therefore, it's crucial to seek medical assistance promptly for a preventive and effective approach to possible cardiovascular problems. But of course, prevention is always best. Preventing cardiovascular problems related to leg pain begins with adopting a healthy lifestyle. This includes maintaining a healthy body weight, following a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, and avoiding excessive consumption of saturated fats and processed foods. Additionally, it's important to engage in regular exercise, including aerobic activities such as walking, running, or swimming, to promote cardiovascular health and maintain adequate blood circulation. Quitting smoking and avoiding excessive alcohol consumption are also essential prevention measures. Furthermore, it's crucial to control risk factors such as high blood pressure, high cholesterol, and diabetes through medication if necessary, and regular medical monitoring. Staying vigilant for warning signs, such as persistent leg pain, and seeking immediate medical assistance when necessary is also crucial to prevent serious complications related to heart and circulation. With these preventive measures, it's possible to significantly reduce the risk of developing cardiovascular problems and enjoy a healthier, more active life. Want more content on cardiovascular health and well-being? Subscribe now and leave your comment below sharing your experiences and doubts. We're here to help you take better care of your health. And if you liked this content, give it a thumbs up on the video so that YouTube delivers this content to more people in need. Remember to check out our exclusive content at the link in the first pinned comment if you want to learn how to improve heart health. Alright? Thank you very much and see you soon.